Bismillahirrahmanirrahim. Assalamu alaikum. How are all of you? I hope you all are doing great. My name is Dr. Alina Roshan and I am here with you with another video. In this video, I will discuss about the drug picture of Belladonna. In this section, I will tell you about the Belladonna in 3 sections. These sections include the plant information, symptoms, and modalities. So let's talk about the plant information. The scientific name is Atropa belladonna. Common name is deadly nightshade. Atropa belladonna is native to Central and the Southern Europe as well as some part of the Asia. For medicinal purpose, it is cultivated in many countries like France, North America, especially in the western and the northeast part of the United States. So let's talk about the second part of the video, that is the symptoms of the belladonna patient. First of all, I will tell you about the mind and head. The mind of the patient is that he lives in his own world. He is very furious, bites everything, desire to escape. He is very hallucinate, means he sees monsters. Retina is insensible to actual objects. He has loss of consciousness. Next, I will tell you about the head of the belladonna patients. It includes vertigo. Vertigo means loss of balance, spinning head or dizziness. The hair of the belladonna patient is dry and split. He always borrows a pillow below his head. While sleeping, he feels worse headache on the right side of his head. Now come on the end of the slide. That includes face and the eye symptoms. The face of the patient is red, bluish red and hot. It is swollen. Swelling of upper lip has been seen in the belladonna patient. Facial neuralgia, itching muscles and the flushed face has also been seen in the belladonna patient. Next are the eye symptoms. Throbbing deep in the eyes on lying down. Eyes are dry and burned. Eyelids are swollen. Photophobia. Photophobia means fear of light. Next slide include the ear and nose symptoms. First include the autophony. Autophony means unusual loud hearing of person's own voice. Second is the humming noises, sensitive to loud tones, acute and subacute condition of eustachian tube. And what is eustachian tube? Eustachian tube is a linkage that links middle ear to the back of the throat. The function of the eustachian tube is to keep air pressure at the right level. Next one is the nose symptoms. It includes imaginary odor, bleeding of nose with the red face, and coryza. And what is coryza? It is defined as the inflammation of the mucous membrane of nose with the discharge of mucus. Next include the mouth and the throat symptoms. The mouth of the belladonna patient is dry, pain in teeth, tongue red on the edges, and stammering. If we talk about the throat of the belladonna patient, tonsils are enlarged, throat feels constricted, esophagus is dry. So let's talk about the end of the slide, that includes the stomach and the stool symptoms. The stomach of the belladonna patient is loss of appetite. The patient hates to milk and meat. The patient feels great thirst for the cold water. He feels uncontrollable vomiting. Next is the stool of the belladonna patient. He feels stinging pain in rectum. Piles are more sensitive with the backbones and stool color is green and it is thin. Let's talk about the urine symptom of the belladonna patients. The urine is scanty, dark, turbid. Turbid means not clear in its appearance. It is incontinence and always feel continuous drops. And now if we talk about the male and the female symptoms. In males, nocturnal sweat of genitals, flow of prostatic fluid, testicles are hard, inflamed, and desire diminished. In female, breast feel heavy, hard, red, and tumors has also been seen in the belladonna patients. Dryness and the heat of vagina, menses increased, bright and red, too early, and too profuse. This slide includes the respiratory symptoms. The patient feel barking cough, drying in nose, fauces, larynx, and trachea. Patient feel dry cough that is worse at night, stitches in the chest when coughing, and genie stalk respiration. And what is that? It defined as gradually increase in the breathing level and the gradually decrease in the breathing level spontaneously. Now there is a heart symptoms. It include violent palpitations. And what is palpitation? It is the sensation of a heartbeat that patient feel that her or his heart is beating so fast or running so fast. Heart seem to enlarge, rapid but weakened pulse, throbbing all through the body. Now, there is a skin symptom of the Belladonna patient. The skin of the Belladonna patient is dry and hot. It is swollen, sensitive, burn scarlets, eruption like scarlatina suddenly spreading, suppurative wounds, alternated redness and the paleness of the skin. Erysipelas. And what is erysipelas? It is a conditions or it is a bacterial infections that infect the upper layer of the skin. Fever symptoms include coldness over the entire body with paleness of face, hot head and the cold cheeks, dry head and the patient feel thirst. Sleep symptoms are the patient is restless, crying out, scream out in sleep, sleep with the hand under head. This section includes the modalities. It includes aggravation and amelioration. Aggravation is a condition when a patient feels that he is not feeling well. And a belladonna patient doesn't feel well when he is touched, when there is a noise, draft, when he is looking at the bright shining objects in the afternoon, and when he is lying down. Amelioration is a condition when a patient feels very well. Belladonna patient feel very well when he is standing or in a semi-erect positions, when he is resting, and when he is in a warm room. This was all about the drug picture of Belladonna. I hope you like this video. If you like this video, please like, share and subscribe. Thank you.